Okay. Good evening, everyone. Welcome to this evening's webinar, Sleep Health in Seniors, organized by Sage Counselling Center. So thank you everyone for joining us tonight. I hope everyone has had a good dinner and are ready for the talk. So tonight's topic revolves around sleep health in seniors. I am sure many of us, if not most, are here because we have experienced some trouble sleeping or find our quality of sleep affected, especially during COVID, and want to find out about what causes it, how to treat it, and how to prevent it. So we hope that you will be able to learn something from tonight's talk and even share your learnings with your friends and family too. But before that, I know that there are some friends joining us online for the first time today. And as we wait for more friends to log on and join us, please allow me to take a few minutes to share about Sage Counselling Center and what we do. As our name suggests, one of our key services lies in counselling. So this service is free for Singaporeans and permanent residents aged 50 and above, as well as their caregivers and family members. So if any of you are interested, we are located at Jurong Point Shopping Centre next to Boon Lay MRT station. So you can call us or drop us an email to find out more. Our contact details can be found at the bottom of the slide. Secondly, we have another service that is accessible to anyone that has a phone, regardless of your location. So this is called the Seniors Helpline. Anyone who would like a listening ear can just call in and share about your challenges, or simply just to chat. That is also okay. Our trained volunteers will pick up your call. We also have public education, such as today's webinar. Next, a lot of our services involve volunteers, so if you are interested, we also provide volunteer training. So just now, like I mentioned, we have counselling, and part of counselling is our group work. So we have an upcoming program, which is called Guided Autobiography. So that is a program designed to help seniors write and share about their life stories. So it is actually a meaningful journey of self-discovery and helps you to connect to your past and your future. It starts on 10 September and runs for 6 Saturdays from 10 a.m. to 12 p.m. at Sage Counselling Center. So please drop us an email for more information. I will also place the email address in the chat box. Okay, so the next few services and programs are very popular. We have the home maintenance service that offers free basic home maintenance and repairs for seniors who may not be well off. So seniors just need a Blue CHAS card or to be receiving community assistance. For this service, we do repairs such as fixing light bulbs, leaky taps, and more. So if you know of any seniors in need of repairs, you can call us to find out more. We also have arts and culture programs. For Reminiscence Walk, before the pandemic would bring seniors out to tour different cultural and heritage sites. We also have the Expressive Therapeutic Art and the Music Ambassador program. So we welcome seniors who know how to play a little bit of ukulele to join us in our music jamming sessions. So just now I also mentioned our home maintenance service, and we are currently raising funds for seniors. So for seniors with minimal resources, costly repairs may deter them from, seeking rectifications to their homes, which may lower standards of hygiene, health, and safety. So each donation will enable us to carry out basic handyman work for the needy elderly at home. I will place the link to more information in the chat box for everyone. Okay, moving on, please also note that we have an advisory on personal data protection. So during this webinar, photos and videos of you may be taken for publicity, training, and marketing purposes. So we would also like to gently remind our audience about a few pointers. So For this webinar, video functions are disabled during the talk. So if you wish to speak during the Q&A segment, we can invite you to unmute yourself. Please also do not record this talk in sound, video, or photography, as the contents are subject to copyright. So if you have questions, you can leave them in the chat box, and we will try to post the question on your behalf during the question and answer, which will be after our speakers have presented. So due to the large turnout today, we apologize in advance if we are unable to answer all your questions and seek your kind understanding on this. We would also like to mention that we are not able to share the slides, as the content of the talk contains sensitive and confidential information. So for everyone who has just joined, thank you for joining us today for our Sleep Health in Seniors webinar. Without further ado, let me just introduce our speakers, starting with Dr. Goh Ka Cheng. So Dr. Goh is a consultant family physician at the Department of Psychological Medicine, NUH. So she holds a Master of Medicine in Family Medicine, a Graduate Diploma in Geriatric Medicine, and a Graduate Diploma in Mental Health. So she consolidates care for elderly patients with complex care needs and is active in the training of clinicians, nurses, allied health professionals, and community partners. Our next speaker is Dr. Su. So Dr. Su is a senior consultant psychiatrist and program director of the Assessment and Shared Care Team, SCAT, with the Department of Psychological Medicine at NUH. He holds a Master of Medicine in Psychiatry and has an interest in community psychiatry. So he sees adult patients in NUH and is active in the training of primary physicians and community partners involved in care of patients with mental health conditions. Okay, now without further ado, let me pass the time to Dr. Goh. Dr. Goh, please.
Thank you, Marita. So I share my screen. Okay, right. Yes, good evening, everyone. And thank you for having me. It's a privilege to be sharing some little nuggets with you. I will first begin my talk by sharing some common complaints that you commonly hear seniors talk about. You may find these complaints familiar, be it yourself or among your friends who may have shared these complaints. How do I move my slide? How come it doesn't move? Let's try. Okay, yeah. Yes, now it moves. The slide changed, right? Okay, so yeah, first we go through some common sleep complaints in the elderly. This cartoon shows a very frustrated elderly woman trying to fall asleep and always looking at the clock, looking at, and you know, things start crowding the mind, and then sleep becomes even more remote. So the common sleep complaints in elderly could be a combination of all of any of these, which would be like can't fall asleep, can't sleep, keep waking up, or waking up too early, or they may say that, oh, it feels like I have not slept the whole night. The whole night has been just staying awake, or else they find that the sleep is very shallow. And this would result in excessive daytime sleepiness. They feel tired the next day. And it can also lead to worry about not being able to sleep the following night and the following night and the following night. And the worry can itself become a problem that perpetuates the sleep disturbance. So really, blessed are those who can sleep like a baby as age catches on. So I'm going to go through a few things. Firstly, understanding normal sleep cycles, and then understanding the changes of sleep with aging, age-related changes in the urinary system that can affect sleep, and some common medical conditions that can disrupt sleep. And to know when is it a problem, giving you a simple definition of insomnia. And then lastly, I'll talk on sleep hygiene. Okay, so this is just a brief on the sleep physiology. Our sleep is not actually even kind of thing throughout the night. It occurs in cycles. So each cycle actually consists of 4 stages, and the cycle lasts between 90 to 110 minutes. And through the course of a night, we go through 4 to 6 cycles. And these sleep cycles vary not only from person to person, but also within the same person, it can vary from night to night. And to complicate matters, as the night wears on, the composition of each cycle actually changes. So the 4 stages starts with the first one that is consisting of light sleep, and it lasts a very short time of 1 to 5 minutes. And during this stage, it is actually quite easy to wake someone up. But if left undisturbed, the person can then move quickly into the stage 2. So a lot of you would have experienced this. During this stage, you may suddenly have a sensation like you're falling from a height, and then you may jerk with a start. And following that, you will go back to sleep. And that is the next stage when the body prepares to enter deep sleep. So in total, a person spends about half of their sleep time in this stage, stage 2. The third stage is maybe I should explain the non-REM. REM stands for rapid eye movement, and the NREM stands for non-rapid eye movement. It is not important for you to know, just understand that we have stages of light sleep and deep sleep. So stage 3 is when a person goes into deep sleep. From the second stage, when a person prepares to go into sleep, the system starts to slow down, the heart rate slows down, the breathing becomes slower, the muscles start to relax, and then builds into the stage 3. When during this stage, it will be very hard to wake a person up. And if indeed a person suddenly gets woken up, he may feel very groggy and disoriented for a few minutes before he starts to become alert. And finally, you have stage 4. Stage 4 is a stage whereby our eyes move, and that's why it's called rapid eye movement. And during this stage, what happens is that this is commonly the stage when we have dreams, and it's also the state where our muscles actually become in a paralyzed state, except for the eyes. And so therefore it is called rapid eye movements. And of course, the respiratory muscles remain functional throughout all these stages. So dreams tend to be more intense during this stage. It's not that dreams cannot occur in the other stages, just that they are less common. And as the night wears on, the stage 4 sleep actually gets longer. So as I said, these stages actually vary, fluctuate throughout the night. So you go through 4 to 6 cycles, and each cycle is a little bit different from the cycle before. And as the night wears on, the stage 4 sleep actually gets longer. So in total, this stage 4 of the sleep makes up about a quarter of the total sleep time in the adult. Right, so what are the factors that can affect sleeping stages, the sleep stages? One would be age. Of course, in the newborns, they spend far more time in the stage 4 of sleep, and they may also enter the REM stage sleep very soon. That means they go into deep sleep quite soon from the earlier stages. Unlike older people, we tend to go through the stages in a longer time before we finally reach the really, really deep sleep. And also recent sleep patterns, for example, shift work, or irregular overtime work that cause late sleep, early rising, or insufficient sleep accumulated over days. All these can cause an abnormal sleep cycle. And then, of course, drugs and alcohol can also alter the sleep architecture, which means how the cycles go through how the sleep stages cycle through the night. So that is what we mean by sleep architecture. And certainly there are many primary sleep disorders that can affect the sleep cycle. Right. So the next thing I'm going to cover would be changes in sleep pattern with aging. So the first statement, decreased need for sleep, is not something that all sleep researchers agree on. While many believe that there is a decreased need for sleep as we age, some researchers state that actually the amount of sleep that is needed is the same. but certainly all the other statements are fairly universal. So what is the phase advance in the circadian sleep cycle? When we talk about circadian sleep cycle, it is a natural body rhythm. It's like an internal clock that tells us when it's time to sleep and when it's time to wake up. So an elderly person, you know, when we're young, we can stay awake up to like 11 midnight, and then as we grow older, we may sleep earlier and earlier, and then by the time an elderly person is 80 years old, may actually go to bed at 8 p.m. or 9 p.m. So this is what is called a phase advance in the sleep, in the circadian sleep cycle. And obviously, if they go to sleep earlier, they also end up waking up earlier. The other thing is the reduced melatonin secretion. Melatonin is a natural hormone that our brain produces, and it regulates this rhythm, this internal clock rhythm. With the reduced melatonin secretion, then the internal rhythm becomes dampened, right? Also, the changes, the other changes would be taking a longer time to fall asleep. Total sleep duration becomes shorter. The depth of sleep also becomes lighter. So this is due to the deep sleep phases becoming shorter. And finally, and the next one is the reduced sleep efficiency. Yeah? The sleep architecture becomes very disrupted. Oftentimes, there will be a lot of transient arousals and awakenings, be it like by noise or by the need to go to the toilet. And then after returning from the toilet, or after some slight disturbance, whether it is like a very warm night or some noise in the neighborhood, and when you are aroused, you become very difficult to go back to sleep. Yeah. Okay, next is our urinary system. There are many changes that actually occur in the urinary system that also will impact on our sleep because of the way urine is produced and the bladder senses the need to pass urine. So, you know, our kidneys are made up of filtrating units, which as we age, they decrease in number as well as in their efficiency in concentrating urine. So as a result, we will end up producing more urine as well as more diluted urine. Then there is also this blunted response to the effects of this hormone called antidiuretic hormone, ADH for short. This hormone is actually important for for our kidneys to concentrate urine and to produce a sort of like smaller volume of urine. But because of the blunted response to this hormone, then the kidneys end up producing more urine as well, and also more diluted urine. So all the effects are adding up. The other thing is the blunted circadian rhythm on ADH secretion. So the antidiuretic hormone is important in limiting the number of voids in the night, because the internal rhythm of the body causes the ADH to be produced more in the night than in the day. And so therefore, with we can sleep through, when we are younger, we can sleep through the night without actually having to wake up. But because of this blunted circadian rhythm of this hormone being produced, then the number of voiding in the night becomes increased. And also the fluids that we take in the evening tends to take longer for the kidneys to process, and it's also the result of a combination of the above factors. The other thing is our bladder, structurally as well as functionally. So the bladder gradually loses elasticity due to increased collagen deposition in its walls, increased fibrous tissues leading to a decreased bladder capacity. And then because of the increased collagen and the increased fibrous tissue, the way it contracts and expands is affected, and then this can lead to incomplete voiding as well. And because of incomplete voiding, there's always residual urine left in the bladder, and that means that it takes less time for the bladder to feel full again, and then that leads to frequency of passing urine at night, and we call that nocturia. The other problem would be commonly seen in men with the prostate gland being enlarged. This leads to incomplete bladder emptying because of the obstruction to the bladder outlets for the urine to come out. And of course, in women, there's the lax pelvic floor, there's the uterovaginal prolapse. This is the prolapse of the womb or the vaginal wall that collapses onto the bladder, and then it can compress on the bladder and cause incomplete emptying of the bladder. Now we go on to some medical conditions that can affect sleep. For the heart and the vascular system, we have the condition called ischemic heart disease, and it causes angina, which simply means chest pain. And this can severe heart disease can actually cause chest pain in the middle of the night, and then the person can wake up in a cold sweat in severe pain. Sometimes it may not be severe pain, it may be just niggling pain, but it can keep causing a patient to wake up in the middle of the night. So these are some things that you may want to be aware about and seek medical attention. And of course, heart failure, where the heart is unable to pump the blood out, and that causes a backlog of blood inside the lungs, which then causes fluid to be accumulated in the lungs, and this will lead to breathlessness. People with heart failure may not be able to lie flat when they sleep. They need to prop themselves up, their head up with 2 pillows, so that they are the heart is at a higher position than the rest of the body, and then the circulation can occur better. Then they avoid the problem of the fluids in the lungs. The other condition is like, ischemic heart disease is the narrow artery that supply blood to the heart. For the lower limbs, you have narrow arteries that supply blood to the muscles in the legs. So if, let's say, the arteries are clogged up by cholesterol plaques or some other problems, then it can cause pain, and this can also occur in the middle of the night if the blockage is severe. And certainly the pain can wake the person up. Next would be conditions related to the lung. Sleep apnea. The obstructive sleep apnea is a very common condition. People who are overweight, who have a thick set neck, they tend to have this problem. If you notice that your spouse snores a lot in the night and seem to be quite often gasping for breath intermittently during the sleep, then you want to suspect that maybe there is this problem called obstructive sleep apnea. And usually the person will be very tired in the day because the sleep is very disrupted, and then may not be able to concentrate well at work and various activities. And the other two that commonly cause breathlessness would be asthma and chronic obstructive airways disease, usually in smokers. This will cause the airways to be narrowed, and then airflow becomes affected, and this can actually cause acute breathless episodes in the night, and again disrupts the sleep. We move on to gastrointestinal conditions. Gastric reflux, what is commonly known as heartburn, is when gastric juice goes in the opposite direction from the stomach into the food pipe. And this can cause burning sensation, can cause pain or discomfort, and also disturb sleep. And people who tend to get gastric reflux, if they take heavy meals before their sleep, too close to sleep, can aggravate the symptoms. And then you have this condition called peptic ulcer disease, where there's actually an ulcer. It's like if we have an ulcer in the mouth, sometimes this ulcer occurs in the gastric lining. It's actually an erosion and can cause pain in the middle of the night as well. Some people with irritable bowel syndrome, they can have cramps, abdominal cramps. They can have the urge to pass motion. Sometimes it's watery stools, and all this can disrupt the sleep. And of course, constipation as well, because constipation itself can actually cause colicky pain in an attempt for the bowels to actually push the motion out. So it's actually churning. the contractions are going on, and this can occur in the night. Right, so the next system I'm going to talk about would be our neurological system, nervous system. There's this condition called Restless Leg Syndrome, whereby a person feels restless. Usually it is felt in the leg, but it can be actually any part of the body. And so the restlessness causes the person to be unable to sit still or to lie still or to lie down even. And the need, this need to get up and move about. Restless leg syndrome can occur by itself without any other conditions, but more commonly it is associated with people with poorly controlled diabetes, as well as those with chronic kidney disease. And then you have Parkinson's disease, where there is tremors at rest. That tremor can keep the patient awake, or stiffness. The patient feels like locked in, you know, when it is not optimally treated. And all these can disturb sleep. Not to mention that in Parkinson's disease itself, excessive sleep in the daytime is actually a part of the disease, and this can mean that the patient ends up sleeping less at night. And finally, the other thing which is not common is phantom leg syndrome. This actually more in patients who have had a amputated limb, be it foot and below the knee, or just a foot or an arm. And it is the sensation that the amputated limb is still present. It can be in the form of pins and needle sensation, or it can be in the form of pain sensation. And because in the night time, you know, the stimulation of the senses is much less in terms of noise, visual stimulation, and you are not involved in you're not engaged in activity, then the symptoms become much more pronounced, and that can really disturb sleep. Okay, next, the musculoskeletal system. Of course, a lot of elderly people may have painful joints from osteoarthritis. They can have muscle aching and bone pain due to cancerous conditions. This all can contribute to pain. And then the kidneys, I've covered a lot about the aging kidneys, and kidney failure, the other thing, because with kidney failure, then the urine production also becomes disrupted, and the effects of the antidiuretic hormone that I mentioned earlier on the kidney is also affected. How does poorly controlled diabetes affect sleep? It does so by causing a lot of urine to be produced, because the body is trying to get rid of the excess sugar in the blood, and therefore the kidneys are actually filtering, the filtrating units are filtering a lot of the sugar out. And as a result, the volume of urine becomes increased. And this will lead to increased number of voiding, both in the day as well as in the night, as well as the volume of urine passed is also more. Okay, so commonly, skin problems are common in elderly. What is the most common is Acetic Eczema. It just simply means eczema caused by dry skin. Why is it common? Is because as we age, our skin naturally lose the cells that produce sebum, you know, which is oil. Put simply, oil, and these cells are reduced in number as well as reduced in production. The cells that remain actually produce less. So as a result, and plus on top of that, our skin also lose the lipid layers, lose the collagen layer, you know, and then our skin becomes drier. And dry skin can be itchy, especially if we have habits like bathing with warm water, hot water heater, and you have all these marketing advertisements telling you to use this soap or that shower gel that clears 99% of the bacteria on your skin, and you believe them, and then you go and use plenty of those for your bathing. They actually dry the skin even further. Okay, there is no need to clear the bacteria in our skin, because our skin is a natural barrier. Unless there is a cut or a break, some break in the skin, bacteria cannot go inside our body. And what is in our skin are actually our residents. It's like we have permanent residents in the country. The bacteria in our skin are our permanent residents that are actually good for us. So you don't want to clear them by using something that claims to clean off 99% of bacteria in your skin, right? Okay, so Acetic eczema, why do I want to talk so much about it? Because it is very common, it causes itch and it keeps patients awake at night because of the itch. And one can do very simple measures, which is, as I said, avoid hot showers and avoid soaps that actually have perfume or that is potent, very strong, it clears the grease from your skin, and use plenty of emollient, meaning those skin moisturizers. Again, avoid things that are perfume, but use blend preparations like QV or urea cream, okay? And of course, less commonly would be skin infections and pressure sores. When these are present, certainly you would go and seek medical attention. So quickly, I think this is my last slide. Conditions that can affect on the other miscellaneous conditions that can affect sleep. Drugs, whether it is prescribed or over the counter, like for example, you're having itchy throat or cough, runny nose, and then you buy some over the counter preparation. They contain this ephedrine, pseudoephedrine. These are things that can cause you to be alert and keep you awake. And then, of course, drugs of abuse can really disrupt the sleep cycle. Psychiatric conditions that Dr. Su will go into detail, depression, anxiety. The thing about depression is also that, it can manifest with early morning awakening. So, and as I mentioned earlier on, one of the common symptoms that elderly people have when they have sleep trouble is they wake up too early. So we have to differentiate whether it is really just sleep problem or it is actually a manifestation of depression. And of course, various anxiety disorders and even anxiety over happy events, major life events, like for example, an adult child going to get married soon, and then you can be so excited and yet anxious, and then that can actually cause one to stay awake, or other major life events that are sad, like for example, a major serious illness in a loved one or the death of a loved one. Then for psychosis is when before the symptoms of the condition manifest in the early phase, they may actually present and they may actually complain of sleep disturbance. So that is the other thing. And then, of course, alcohol. People believe that, I take alcohol, I can sleep better. So it's true to a certain extent because alcohol does help people to fall into light sleep. But however, it reduces the deeper stages of sleep, and then it actually leads to a disrupted sleep overall. So it is not recommended. And finally, cigarette and caffeine. If these two taken too soon to bedtime can actually cause difficulty falling asleep. Okay, yes, I have a couple more slides. I think I'm in good time. So, of course, when we talk about management, we must ask ourselves whether it is a problem. So it is a problem if it is affecting the person's functioning in the day, feeling very tired and sleepy, unrefreshed even after say 8 hours or 7 hours of sleep, then have a headache, unable to concentrate, easily irritable, very grumpy when you talk to them. Yeah, so if the person has all these symptoms, then yes, it is a problem. And of course, we want to address any medical conditions that may be causing or contributing to the sleep problem. This talk is not about addressing all those medical conditions, but I gave you a list of them so that and some of the common symptoms, so then you will know when you need to seek medical attention. And then of course practice good sleep hygiene. Yeah. So when we say that a person has insomnia, actually there are criteria. And it means that there is difficulty initiating and maintaining sleep, or there is unrestorative sleep for at least 3 days a week over a period of at least 3 months. And this is despite adequate opportunity for sleep. and it causes significant distress or impairment in functioning. And the symptoms, the complaints are in the absence of other primary sleep disorders or medical, neurological, or psychiatric conditions that are known to disrupt sleep. Okay, so of course, a lot of times we don't wait until we have at least 3 days a week for 3 months before we seek help, right? So yeah, it is always when you feel that you are suffering from lack of sleep, and then you want to seek advice how to manage it early on. So, okay, sleep hygiene. Importantly is not to go to bed when you're not feeling tired, because then you might end up staying in bed for a long time, and that itself can make the sleep onset more difficult. And the bed is only for sleeping, not watching TV. And this is a good advice, but I must tell you, I'm guilty of that too. Watch TV in bed. And then, of course, the sleep environment is very important. The bed, the mattress, the pillows, they must be neither too hard nor too soft. Of course, different people have different preference. The noise level and the light level, as well as ambient temperature, whether it is too hot or too cold. And using gadgets before sleep can actually make it difficult to fall asleep because of the stimulation. And certainly other stimulating things like caffeine, smoking, and exercise. Because if you exercise too close to your bedtime, all the adrenaline is rushing through your blood system, you know, and it takes time for it to settle down. So that will delay your going to sleep. And understanding earlier on from the slides earlier on, the changes that our kidneys, our bladders go through and our hormone systems go through with age, then it is wise not to take too much liquid after dinner, so that your kidneys won't start producing urine, and then in the middle of the night you feel the need to get up to go to the toilet. What is meant by double voiding? Meaning like you may have you may be going, you know that you're going to sleep, so you go empty your bladder. But before you actually get into bed, you still are doing some other things here and there, a little bit of this or that, and by the time it may be 15 minutes or half an hour even. Never mind whether it's 10 minutes or just before your last trip to the toilet, or it's half an hour from your last trip. Now you are absolutely going to bed already. You go and void again, and this would really empty your bladder to as little residual volume left as possible. And again, this means that it will delay the time for the bladder to build up to the next urge to pass, okay? And keeping active in the day is very important. Avoiding naps. A lot of our elderly people, they nap in the day, then it becomes, it makes sense that they cannot sleep at night, or else they are very sedentary in the day, and they don't have enough energy expenditure, and that makes sleeping at night very difficult as well. Those who are homebound, you know, they may not have enough light exposure, which helps us to maintain our internal body's rhythm. So therefore, enough light exposure is important as well for healthy sleep cycles to be maintained. And the timing of medications is also important. For instance, medications that can cause alertness should be taken way early in the day. Medications that can cause increased urine output should be taken before 4 p.m. Like some patients with heart failure, they are given medication that drives out the water from the system. And if they take it too late, then the medication works. By the time it works, the patient is sleeping, and by the time the urine is produced, he's in the middle of sleep and he has to wake up with a feeling of a full bladder and the urge to pass. So the timing of these medications will help to reduce their effects on the sleep. And finally would be relaxing, winding down, slowing down, getting the body ready for sleep. Yeah, so these are measures for sleep hygiene. Okay, this is just a cartoon to show you that sleep problems may not just affect us, can also affect the people we sleep with. So therefore, if you have a problem, seek good advice and seek timely help. So with that, I will stop share.
Okay, thank you, Dr. Goh. Now may we invite Dr. Su to continue with the sharing.
Okay, can enable me to share the screen?
Okay. Oh. Okay. Can try again.
Okay. Can you all see the slide?
Can see the slide.
Okay. Good evening to everyone. Hi, I'm Dr. Su. Thanks for inviting me. It's quite enjoyable to listen to Dr. Goh also. Learn quite a lot from her. Yeah. So this evening I'll talk about some of the common conditions, the psychiatric conditions that can cause insomnia, as well as talk about some medications. I really see some questions floating around talking about medications. So I'll try to cover this. So I'll try to customize. I'll talk about it in terms of like a case study, share in terms of like a story to make it a bit easier for you to understand. The first case, all these are kind of stories that I make up, right? The first case is this Madam Tan. She is this 75-year-old retiree. She has unfortunately lost her husband 2 weeks ago. Husband had passed away from cancer. He's battling from colon cancer for the past 4 years. Although she felt it was a relief for him to be free from pain and suffering, she actually missed him a lot and thought about him quite a lot. Every time when she thinks about him, she tears up, even though she knows that he's in a much better place. But in the night, she missed his presence. He find it very hard to sleep. So this is a condition what we call as grief. Probably some of you maybe may heard of someone or may have encountered it before. And grief reaction is one of the common cause for sleep problem. Common reactions, symptoms you see in grief will be shock, sadness, anxiety, anger, sometimes even bargaining, asking why this happened. Yeah. Of course, sleep problems, right? And grief does take time to resolve. And unfortunately, there's no quick solution to say that, oh, no, grief goes away, within a week, a month, it takes time. There's no specific time. Sometimes it can take up to years, or sometimes even like special occasions, like some anniversary dates, grief does occur again. So we usually tell people to give them lots of time and space. And understandably, sleep might happen in the context of grief. How do people deal with grief is actually quite individualized. Some people prefer to talk, and they can go for counseling like Sage. Some people prefer to do it alone. They need some time to be alone. So it depends on each individual. There's no kind of one standard way. Some will ask whether they should use medications. Medications in the context of grief is not always a must. They can use it if they really feel the symptoms bother them a lot after discussion with the doctors, but it's not always necessary. Sometimes they can monitor it for a couple of months and see how it goes. So that's grief, that's causing sleep problem. And in Madam Tan's context, she was initially having sleep for a period of time whenever she thought about her late husband. She eventually saw a GP, give her some medications, but she hardly used it at all, right? What she actually did find helpful was to talk to her sister, who was a pillar of support. They linked her up with some counseling at her own religious organization, but she felt actually she still can handle it. So she take it, she recall it, she put it in the back of her mind. What she actually did is actually keep herself busy with her grandchildren, sometimes share stories of her late husbands to them as a way to remind her of him. Right. So that's grief, and grief causes sleep problem, but sometimes we can watch and wait, and sometimes it's all right. and not to take any medications for that. Second case study is Madam City. She's a 65-year-old lady, right, who lives with her daughter and son-in-law, right. She knew her son-in-law has lost his job recently, and things has not been going very well for the couple. They have been quarreling a lot, and she's quite worried for her daughter. She looked at her daughter, who has been crying at times, so she can't help but very worried about what this young couple are going to, how are they going to handle. So she would think about them, she would worry, and then she wouldn't be able to sleep well. Especially sometimes she would hear her daughter crying in the other room. Right? Sometimes she also tear up herself. She find it very hard to sleep because she would think about her daughter, and she will try to keep a lookout for her. So in this context, it's like a normal stress, right? A normal reaction to stresses in life. And we call that, in psychiatry, we call that adjustment disorders. When someone have a kind of emotional response in reaction to stresses, with daily stresses like money problems, sometimes marital problems, family conflicts, etc. All right. And the common response will become depressed, may become teary, become anxious, and sometimes along with that, they lose sleep over it because of the stresses. All right. Adjustment disorder is not uncommon, and sometimes what we try to do is to try to support these people to help them overcome the stress. Of course, they can go for counseling, again, like going to SAGE, right? They can get some counseling. There are some organizations that also helps them to tide them over this difficult period, right? For money issues, to go to social service office. If they need a job, they go to E2I. And of course, at family service centers, there are also counselors that help family members deal with marital issues or family problems. All right. We don't always have to give medications for the symptoms. If they do a request, we can discuss. There are some medications sometimes we consider, like antidepressants for the depressed mood or the anxiety symptoms. And sometimes if it really causes about sleep problems, you can use it for a period of time just to tide them over this difficult period. What we generally do notice is that when the stresses are being resolved or removed, the symptoms generally do improve. All right, and subsequently, those medications can be stopped as well. So that's adjustment disorder. And in Madam City's case, what happened to her eventually, she tried to remain strong for her daughter and encourage her. What they try to do together is go for some exercise together in the morning as a way to de-stress. Eventually, they found there are ways they can get a job through her friends, through her neighbors. They'll be telling her where the place they can get a job. And her son-in-law eventually found a job 3 months later. Since then, conditions at home has improved, the couple are quarreling less, and she felt less worried. And eventually, her sleep problem also resolved. Right? The third case is Madam Chan. Madam Chan is a 72-year-old housewife. She also finds it very hard to sleep. What happens to her is that she has been feeling depressed for a period of time. Most of the time, she's been feeling this way. And she has lost her interest in the usual activities as well. She used to love Korean and China dramas. But you find that she has no longer have this interest to do that anymore. This lasts for almost a month. Even when her siblings ask her to come out to meet up, she also declined. She becomes more withdrawn, kept to herself. What happens is that initially, things has been quite hard for her. When her husband passed away 5 years ago, she felt quite lonely. But eventually, what happens is that she finds it very hard to move out of the house, get out of the house, because she's having all this knee pain. It gets her very immobile, very hard to get out of the house. And because of that, she felt she's cut off from her friends that she knows around her neighborhoods. She felt increasingly isolated. In the daytime, she doesn't eat very well. She also finds it very hard to get out to eat. She felt very useless. Her children does cares about her, but she felt that she don't want to be a burden to them, don't want to bother her children. Then increasingly, she felt more depressed and more alone. So what I described in this case, conditions what we know as a depression. And in depression, And in clinical depression, right, what we need is that there's this persistent sense of depressed mood. The mood, low mood, persists most of the time for at least 2 weeks or more. And regardless of what they try to do, the mood then seems to live up. But sometimes they also have this loss of interest. They stop doing things that they like and they enjoy, stop watching the drama, stop going for shopping, stop contacting people that they know, even when people invite them to become more withdrawn. Sleeps, in this case, get affected. They find it hard to initiate sleep. Sometimes they wake up very early in the morning. Overall, the sleep quality reduces. Appetite also gets affected. When they sleep, they eat very little. Sometimes they may end up eating a lot. Energy level usually goes down. Someone with depression also, they often feel very tired. They may also be very indecisive. They find it hard to concentrate. They often feel guilty, even without good reasons. And this sense of worthlessness. And sometimes in extreme cases, they do think about suicide as well. And what we know about some of the risk factors for people developing depressions is being isolated, especially if they are in pain, chronic pain they are not resolved, as well as the multiple medical issues that doesn't get resolved, affecting them. But depression is a treatable condition, right? Depression does take time to recover, and you do need medications to help them, right? Medications are generally quite safe, even for elderlies. It doesn't work immediately, so it does take a bit of patience for it to work. It takes about 4 weeks for it to work. Sometimes people stop it too prematurely, and they do not need the effect of it. Of course, other than taking medications for the mood, we also manage them in a holistic way. We look at any other medical issues that could be affecting them, including pain issues. Make sure they get adequate treatment for the pain issues, or if necessary, refer to other specialists to control the pain. And what we also try to do is to try to reduce isolation as well, right? To get them link up with the family and their friends, the children if possible, or if not, some befriending services, all right, of some volunteers. So in the case of Madam Chan, eventually her daughter and her sister found what's happening to her. They were quite concerned what's happening to her, hence they took her to see a doctor. The GP who saw her felt that she has depression, started her on medications and antidepressant. And this antidepressant not only helps with her mood, it also helps with the sleep. All right. So after 4 weeks, things get better for her. She was also given medications for pain. She was found that she has this osteoarthritis, a condition where the knee has a lot of inflammations and pain. Eventually, they linked her up to see a surgeon and found that actually, if she goes for a knee surgery to replace the knee, right, it can help to reduce the pain and improve her mobility, right? Her children also and siblings also take turns to bring her out eventually when her mood gets a bit better. And eventually, she's able to enjoy having meals with her children again, right? Case study number 4 regarding Mr. He. So Mr. He is a 67-year-old office worker who lost his brother recently. His elder brother, who's quite close to, actually had a heart attack and passed away quite suddenly. He was otherwise a very healthy individual that's very health conscious. So it's actually, Mr. He was wondering whether this could be due to COVID. He started becoming quite worried for himself because COVID was quite widespread. So he becomes very anxious, start to worry quite a fair bit, start to do some research on his own. You go online, go on internet, start reading up about what is heart attack, how to detect it. He was worried that he may get heart attack himself. So he start to go online and there's lots of information. He start reading up, spend lots of time reading up, and start to become quite worried about it. Eventually, he himself also developed palpitations and quite anxious. He started to go and see his GP. Initially, his GP ran some tests, did examinations, told him that actually you're all right, but he's not convinced. He felt that it could be something more sinister. So he went ahead, did his own arrangement to see a private heart specialist, a cardiologist. He did more tests, scanned his heart, everything is normal. But he still felt he was not reassured. He still felt quite anxious. He couldn't sleep. He kept thinking about it at night. And after a while, even when his friends started asking him out, he also stopped avoiding them. This is a case of anxiety, right? There are many different types of anxiety disorders, right? But some of the common symptoms we see in anxiety disorders are excessive worry. They can't stop themselves from worrying, even though they've been given reassurance, family, friends, doctors tell them they are fine, but they can't stop. It is excessive. And sometimes with the anxiety, it comes sleep problems. Usually in anxiety, there's a lot of checking behavior. You look through things, materials, informations. Sometimes they also start avoiding certain things, avoiding certain day-to-day routines, avoid social contact, right? They begin symptoms, physical symptoms like palpitations, which may mimic conditions like heart attack, may even have difficulty breathing, trembling, nausea, sweating. And sometimes because they are not sure what is happening, then they get even more anxious. Again, anxiety conditions are treatable, right? Medications can reduce symptoms. It does take some time again. Like in depressions, it can take up to 3 to 4 weeks, right? There are a couple of types of medications that we use for anxiety. Some works more quickly for quick relief to reduce the symptoms, the palpitations, etc. And there are some medications that they use over a period of time to prevent and reduce the intensity of the symptoms. Right. Sometimes we also advise the clients, the patients, not to react too much, especially on internet. They take things out of context and they tend to worry themselves more than necessary. Right. So these are things that we can do for someone with anxiety issues. So for what happened to Mr. He himself is that he was told by his GP that he has anxiety disorder. After some persuasions and discussions, he's able to take some medications, some antidepressants for his anxiety conditions. He found that it's actually helpful for his palpitations and sleep. An antidepressant was also used, right? About 3 weeks' time, his anxiety was getting slightly better, right? Not completely gone, but he noticed some difference, right? His children also find it's a bit better. It's much more willing to go out. By 1 month plus, they are able to go out even more, right? So it does take a bit of time for the conditions to get better, right? But it's a treatable condition. So case study 5, right, is about Mr. Chu. Sorry, Madam Chu. Right? Madam Chu is a 55 years old housewife. She claims that there's this electromagnetic waves that's being transmitted to her room. Right? She felt waves, these EM waves, she called them, hitting on her, that's causing her a lot of distress. It caused her headache, it caused her a lot of discomfort. She's quite certain it's from her neighbors, right? Even though she told that to her husband couldn't find any evidence, right? They find that they're living on the top story, but who else could be there on the 13th story, right? But because of that, she's being very distressed. She's been losing sleep. She's very upset. She's very irritable. She felt no relief from this EM wave. What Madam Chu is experiencing is a form of hallucinations. The EM wave that she experienced is a form of hallucinations that she experienced. It's not true. It doesn't happen, but for her, she felt that very acutely. Right? So that's the definitions of hallucinations, when they can perceive certain things where there's actually no actual stimulus to that. It can happen in different modalities. It can happen in sounds, voices, they can see it in sight, they can even smell it, feel it on their skin, or even taste it in their mouth. Sometimes they may have delusions as well. What are delusions? Delusions are false beliefs. Beliefs that stuck with them, they are fixed, and no matter how much time you spend trying to explain to them, they just can't shake off those beliefs. one of the most common type of delusions that we see and hear, what we call paranoid delusions, where they have this false belief that someone is trying to harm them, monitor them, follow them. Sometimes they may have changed in terms of their behavior and their speech. They may talk in a way that doesn't make sense, there are sentence structures that doesn't flow, or they may have odd behavior, like barricading themselves, carving out the windows, putting extra lock and chains, in the front door, thinking that people are trying to come after them and try to protect themselves. Psychotic conditions is also treatable conditions. We do quite a few checkup for someone with psychotic disorders. They included some blood tests as well as a brain scan. Sometimes we also wonder whether it could be due to influence of drugs and alcohol, especially when they suddenly stop using drugs or alcohol. Medications like antipsychotic medications works for psychotic symptoms, right? If the psychotic symptoms are not well controlled, they often have sleep problem as well. Again, medications take some time to work. It does takes about 3 to 4 weeks to work, right? But it is quite a treatable condition. So for Madam Chu, she was agreeable to seek help after much persuasion from her family, right? They tell her to get some help for her sleep problems. She was initially quite upset that her neighbors was emitting the EM wave, but eventually she felt that she shouldn't confront them. She was agreeable to let her husband handle it. Eventually, with medications, she stopped thinking about this as often, about the EM wave. She's able to sleep better, right? She's less troubled by it. Sometimes she still talks about it, but she said, okay, it's fine. I won't be bothered by it. All right. So that's Madam Chu. The last case study I want to share about is Madam Indira. She's a 65-year-old lady who has a long-standing history of headache. And she's allergic to certain type of painkillers called NSAIDs, right? So she's been taking Panadol initially, but she felt that no, Panadol is no longer working for her. She needs to take something more powerful. All right. And recently, she's been getting very upset with the GP because the GP refused to give her these powerful medications, powerful painkillers called Tramadol. She felt she cannot sleep. She's very upset. She also can't do her usual things. Eventually, her family members found that she's been spending a lot of money trying to see GPs, trying to see getting medications. They also find that she's been taking cough syrup in large amount to help her with her sleep. So what's happening to Madam Indira is some form of addiction to certain drugs, right? And these are some symptoms of drug addictions when they increase usage, right? When they are unable to get the drug, they become very unhappy, very dysphoric. It could be irritable. They may get nausea feelings, sometimes even running nose, diarrhea, fever, and of course, sleep problems. They have a lot of drug-seeking behaviors. It seems to crave for their drugs. Everything about her behaviors and activities seems to work towards trying to procure or get the drugs themselves. They find it hard to stop. Sometimes they lose control. They get irritable, they get upset, they get angry, and start quarreling with people as well. Right? They can neglect other parts of their life, and sometimes this can even damage relationship around her, right? So what we can do with someone with drug addictions, right? So these are some medications. This opioid is found in some form of painkillers. It's often sometimes found in some of the strong painkillers as well as cough syrup. Some of you might have heard before things like codeine, tramadol, and Decidil, which is why most of the time your doctors are quite strict with giving these medications. They tell you they can't give too much of it because there's some risk of getting addicted to it. But sometimes people do not know better and they ask to demand more and start to use more of it. What to do for this problem? First step is being able to recognize that this is an issue, right? Best is to prevent, right? The excessive use, prevent the reliance. But if you need to, if you feel themselves getting addicted to it and need some counseling, some help, they can refer to organizations like called National Addiction Management programs or some of a community program called We Care that can help people to overcome addiction problem. So for her, eventually she was told about this concern. She reflected and think that actually she acknowledged she has been getting out of control at times, getting irritable, snapping at family members. Eventually, she decided to work with one doctor, right, who will control all her use of her painkillers instead of doctor hopping among different doctors. She also signed up for some counseling course, right, to help her to learn how to control the use of these painkillers. So those are some of the common causes of sleep issues, right? To kind of summarize that, right? We cover a few of them, right? Grief reaction. Adjustment disorders means someone who is reacting to stress. I didn't talk about some unusual conditions like jet lag and shift work. I hope most of you are not working now, But yes, if you're doing shift work or if you're traveling, sometimes this can cause sleep issues at times. But the more common conditions, psychiatric conditions that I've talked about is things like depression, anxiety conditions, psychotic symptoms, and of course, the last one is dementia, right? When they have memory issues, no change in their ability to organize their life and their daily activities. Of course, last parts will be about drug use, which I mentioned, alcohol, which is being mentioned by Dr. Gu, right? A lot of people seems to think that alcohol helps them to sleep. Well, it's true that alcohol may initially help them fall asleep, but alcohol actually affects the quality of sleep. So they end up the next day, they don't feel as good, right? So often we tell people is that long-term use of alcohol to induce sleep, right, can actually lead to some problems, which we'll generally try not to encourage. So what do we do for sleep problems, right? I think Dr. Goh has covered about sleep hygienes, which I think is very important. This is generally what we start at, right? Telling people about sleep hygienes. And for a lot of the elderly people, sometimes what they do not realize is that they don't need as much sleep as compared to their adult life. The general adult sleeps about 7 hours, but if you're 60 years old and above, sometimes that reduces between 6.5 to 6 hours. But sometimes, because some elderly felt that they have nothing much to do, they tend to sleep at 8 p.m. or even 10 p.m. Right? And when they try to sleep about 9 to 10 hours each night, they find themselves having difficulty falling asleep. So they may need to change their expectations and make some modifications instead. Right? So if there are any psychiatric conditions that I mentioned above, they should also get some help and treatment. They can start off by seeing their GPs, and if necessary, they refer to a psychiatrist. There are sometimes some psychological therapy that can help for sleep problems. We call it CBT for insomnia, right? Most psychologists are able to give that type of advice, right? And of course, the golden questions about medications, right? What medications are used to treat insomnia? There are a couple types of medications in the market, right? Some of you will probably go around to pharmacies and you can see melatonin, right? I'll talk about that. There also are different types of medications like antihistamines, benzodiazepines, Z drugs, as well as antidepressants, which I'll cover. Right. Let's talk about melatonin. Right. Actually, melatonin is a chemical that's produced naturally in your body, in your brain, right? It is produced when it senses it's night, right? When there's darkness. But nowadays, in modern life, there's a lot of light going on, right? Not only just the light that we use, most of the time the issues will be the lights from our handphone, right? Which they say actually mimics the blue light, which is similar as like the sunlight. And that confuses the brain. Right, so we usually tend to say that try not to use electronic devices. That's because of that reasons. Because we want to trick the brain thinking that it's daytime. Right, we want to mimic the usual natural rhythm of the day when it goes to darkness, such that the brain produces melatonin. Right. Another thing that's good to know is actually tryptophan, which is a precursor of melatonin. Basically, before melatonin is formed, tryptophan is required. And tryptophan is actually commonly found in milk, right? So sometimes people feel that drinking a bit of milk does help, right? Provided you don't have any intolerance to milk, right? So melatonin comes in both commercial forms as well as prescription forms. Commercial forms are the ones that you see, in pharmacies. You go there, they come in different dosage, even up to 10 milligram, all right? For the doctors, we also prescribe melatonin, just a slightly different grade. So melatonin, we say, is generally quite good for certain conditions like sleep, jet lag, right? Shift work, they're doing shift work, they have mild sleep issues. The evidence is such that it's quite effective for those who are the 60 years old and above, right? Melatonin is generally not addictive, right? It can be used, but if you read the details from the drug company that produce them, they usually advise not to use more than 30 days, right? So generally, if it's like a short-term use, if you're having jet lag after that travel, or you've done some shift work, I think melatonin is relatively safe to use, right? The other medications that is being used quite commonly is antihistamine. So antihistamine is commonly known as the flu medications or the anti-itch medications, right? You can get it over the counter. It's known as, one of it is called as chlorpheniramine, right? If you recognize it, it's just this yellow pill, all right? There are other types of antihistamine called hydrozizine, right? It does makes people drowsy. Probably, if you try taking any, some of the antihistamine, it does make people quite drowsy. And sometimes we use this to help with sleep. It doesn't work for everyone. It may have a bit of modest effect for sleep based on the literature, but sometimes it works for some. And because it's not addictive, people tend to feel actually quite safe to use this, right? So that is also one option, right? Again, use it only when necessary, right? The other one that is used for sleep is what we call benzodiazepines, right? The more technical term is that it acts on what we call the GABA receptors, what we call the gamma aminobutyric acid. Basically, what it does in the brain is that it has a sedating effect. It reduces anxiety. Sometimes it also used to control fits and seizures, right? So don't be too alarmed if you see all these indications. The common ones that you can see in the markets will be lorazepam, alprazolam, diazepam. There are many more, right? It's effective to induce sleep, but it can be addictive. So which is why your doctors will be very cautious about prescribing this to you. We generally do use it for people with anxiety issues. When they're really feeling very anxious and can't get to sleep, we use this to help to initiate them to get some sleep to break through some of these symptoms of anxiety issues. Right. So this is highly controlled because it's addictive. Most of the GPs will be warning you that you shouldn't be taking too much, and they'll be giving you quite little amount of it. So this not is effective, right? But it'll be good to use in judicious amount. The other one that is quite commonly used in the market is what we call the Z drugs, right? It's also known as the common ones will be sopicolone and sopidem, right? You also touch on the same chemicals, right? You increase the transmission of GABA, which I just mentioned, right? It has a sedating effect, right? So it's quite effective to induce sleep, to start off to initiate the sleep, right? But the brain do get used to its effect after a period of time, right? So which is why it's recommended to use it on an intermittent basis, like every other day, or once 2 to 3 times a week, etc. It's good to use for short term, right? Generally, it's supposed to be less addictive, but we do warn that sometimes we do see people after using for a long period of time, they do develop some symptoms that are similar to addictions. They can get withdrawal symptoms, all right? And sometimes people to get a bit more anxious and agitated, you stop it suddenly. Again, this is your GP should be able to prescribe this, right? It will be probably giving you in a short period of time, right? Sometimes the psychiatrists do use these medications for patients really have sleep problems and they use it for a long period of time, only after we exhaust other methods to help them to sleep. Yeah. The last but not least is the antidepressant. Right? Antidepressant, as its name suggests, is used to treat depression, but it also has other properties. It also treats anxiety conditions. Some antidepressants also have sedating effect. Right? Some of these names you may be familiar, sometimes you may not, but these are some antidepressants that have sedative effect as listed here, like fluvoxamine, mirtazapine, trazodone. Some of the GPs may carry them as well. We usually don't use this as first line for people with sleep problem, but if the person have anxiety problems or depressions along with sleep problems, some of these medications should be used. They are not addictive, all right? So can be safely used for months, or even years. All right, so I think I've covered my slides. Sorry that I overshot them. Yeah. Hope I answered some of the questions that's being shown. Yeah.
Okay. Thank you, Dr. Su. So I think now maybe let me put my screen back up for everyone. Okay. Okay, so once again, thank you to Dr. Goh and Dr. Su for the very insightful sharing about sleep. So before we go to Q&A, there is a short little activity that we have. So it's actually a gentle call requesting for your help in completing our feedback. So each feedback is important as it will not only help us to attain continued funding for our programs, it will also help us to continue to provide free talks and webinars to all of you. So the feedback will be conducted in a short poll that you will see on the screen right about now. So there are 4 multiple choice questions. Does everyone see it? Maybe you can take just a minute to complete the poll, and we will start the Q&A right after this. So please don't leave yet. Yeah, thank you. So meanwhile, if you have questions, you can post them in the group, in the Zoom chat or the Q&A box. We do see a lot of questions coming in. So in the interest of time, we may have to group some of these questions that are similar together. Okay, maybe about 10 more seconds for those who are still almost done with the survey. Okay, so I will end the poll right now. Okay, so thank you everyone for participating in the poll. Don't worry if you haven't finished the activity, as we will have a feedback form that will automatically appear after the webinar ends, and I will also put the link in the chat room later. So let's get right into the Q&A. So gentle reminder to everyone to ask questions in the Zoom chat or the Q&A box. Or if you want to speak to the speakers, you can raise your hand and we'll invite you to unmute. Okay, so maybe I will start off with a question in the Q&A box. So there's someone asking that it is not healthy to take sleeping tablets. And is it true that a person can get addicted? Dr. Su or Dr. Go, would either of you like to address this?
Yeah, perhaps I can answer that. Yeah, like I mentioned, some of the sleeping pills can be addictive, like the benzodiazepines, even the Z drugs. Some are not, all right, like the melatonin, like the antihistamines, they are not. So it's important to differentiate. The GPs usually will be able to help you to answer those questions. Yeah, whether which one is addictive or not. Generally, those who are addictive, they'll usually give very, very little dosage to you.
Okay.
I will also answer the one about melatonin. Will you recommend melatonin tablets for short-term remedy? I say yes, you can use it for short-term basis. It's generally likely to get dependent on melatonin.
Okay. Okay, thank you, Dr. Su. Are there any other questions about melatonin? Let me just go through the questions.
Maybe in the interest of time, I can just take a few of the questions that have very similar content.
Okay.
Yeah, like for example, regarding the amount of sleep that you need, really it varies from person to person. It also varies depending on your activities and the stage of your life. So there is no fixed amount of time that generally it is recommended 8 hours, right? I mean, babies will sleep like 20 hours, and then by infants, by the first year of infancy, it gets shorter and becomes more regulated. And then, of course, then it becomes the toddlers and the preschool years when they only need one nap. And after the preschool years, they don't need naps anymore. And adolescents actually need much longer than what our adolescents are doing now. If there are some young people that you want to advise, is really they also need 8 to 9 hours actually. And so an elderly person may need 5 and feel very fresh. Another may need 9 and feel very fresh. So it's very, very variable. You need to know what is your own need. And then as to whether is it okay for you to sleep at 1 a.m. and then of course it is, because if you are not going to be having to rush to wake up the next day to go to work, you don't have to send grandchildren to school, by all means, I have a lady who will always watch the TV with her husband, some drama, because they want to record it and then they want to binge through a few episodes, so they watch until 1 a.m. and then they go to sleep at 2 a.m. She wakes up at 10 a.m. and she goes for her zoucha. That is fine, So really it's how things fit into your lifestyle. As long as you're getting enough rest and you are, like I say, functional, and Dr. Su has mentioned, it's not affecting your lifestyle, your functioning, then by all means, you can sleep at 1 a.m., right? And then the important thing about noise and light. Light, as mentioned, because the melatonin. And then noise, yeah, if you have, if your flat the window is such that you are right next to an expressway, then it's going to be a problem. Or worse, in my old house, one of the blocks actually right next to the railway track, the railway track that is no longer there. And there's always 2 trains that run through in the middle of the night. So, this kind of thing, then you will have to think about either moving place, or less costly would be to do soundproofing, noise reduction thing. And the other thing one of the ladies mentioned, right, playing light music. We can call it, you can play light music, soft music, you can play white noise. White noise is just simply something that is innocuous in the background, and it can help you to sleep. Yeah, so I think I've lumped a few questions together.
Okay.
Yeah.
Okay,
and certainly keeping awake for long stretches is not a good idea to try and restore your sleep cycle, because you can be so tired that it affects your reflexes. You are more likely to fall down, and if you are an older person, then falling down is not a good thing.
Okay, thank you, Dr. Goh. I see that there is Michael Chong who has raised his hand. Michael, if you are keen to speak, you can unmute yourself. Okay. Maybe while we wait for Michael, I can answer another question, because I do see some questions about taking naps. So some of the questions they are asking, is afternoon nap good for seniors, you know? And then like there is another question, let me find it. I saw another question about about naps lah. So basically naps recommended? Afternoon naps.
I can answer that. Yeah, I think if you do nap in the afternoon, because you might eventually sleep less in the night, right? Because there's only certain amount of sleep that we get in the day. Could be 6 to 7 hours. So if you nap, it's fine, but be prepared that maybe you sleep less in the night. You can't expect to sleep like 2-3 hours in the afternoon, yet another 6 to 8 hours in the night. So basically, it's managing your own expectations. So you can if you want to, but probably you can't sleep as much in the night. So it depends on your lifestyle. Someone asked also about they are sleeping a lot but still feeling very tired. Sometimes we see this when they are not waking up at the same time every day. Our body and our brain tends to thrive on pattern. Remember the primary school, secondary school kids, when they are going to school, waking up at the same time every day, they tend to feel more refreshed when they're waking up at the same time every day. And that's how our brain works. I think sometimes if you're waking up at different timing, you may sleep even more. You think they catch up more sleep, but actually feel up more tired instead. That could be the reason why. So it'd be good to keep to a fixed waking hour if possible. Again, that is up to your own kind of lifestyle, what time you want to wake up, all right? I saw a few questions about what food to take, about milk also, all right? Generally, we avoid certain things with caffeine, coffee, tea, Coke, soft drinks that contain caffeine. So those are things that we should not try to take. Not to take too full a meal at night, like supper, right? If you're feeling too full, it also makes it hard to sleep. There is some evidence that maybe because milk contains tryptophan, but again, like I mentioned, not everyone can tolerate milk. If you have lactose intolerance or you can't tolerate milk, you can try. If it doesn't work, you shouldn't be taking. Whether cold or hot, again, it depends on which one you can tolerate better. All right. Yeah, so those are some questions about the food and drinks. Yeah.
Okay, I see another question about the effects of sleep. So one of the attendees here, she's asking, does lack of sufficient sleep affect organ functions, for example, the heart and the liver?
So do you want me to take that question? Can you repeat it? I didn't quite get it.
Oh, okay. So one of the attendees, she's asking, does the lack of sufficient sleep affect organ functions, for example, the heart and the liver?
Okay, so does it affect the heart? Maybe yes, because if prolonged sleep deprivation, you actually suffer from some, how do I put it, the physiological disturbance can actually cause stress to the heart. And if one has pre-existing heart conditions, then it can actually aggravate it. But if one's heart is healthy, then it's not so likely unless you're talking about really, really prolonged sleep deprivation. Certainly, it will affect the neurological system because your reaction time, your processing speed, your attention, your ability to concentrate, these are all affected. So I would say the most prominent and predominant effects would be on the nervous system. And if let's say you are engaged in machinery work or you are driving, this can be very dangerous. And elderly people who are not engaged in any of these activities, but because of sleep, being insufficient sleep, then their mental functioning is slowed down, their reaction time is slowed down, they may not react fast enough to environmental dangers, and then they can fall down. Okay, so nothing to do with the liver. But since there's a mention of the liver, there's something, one question about, does our body detox when we sleep? Okay, simply put, maybe not so much detox, but you know, our organs are removing waste products all the time. Our liver, our kidneys, chiefly our lungs, expelling carbon dioxide all the time, which is also a waste product, and our skin through perspiration. But of course, when we're at rest, we don't perspire so much. So otherwise, as a whole, when the body is sleeping, the most important function is for cellular damage, repair of damage, okay? Repair of damage and regeneration of cells. So therefore, sleep is important. A healthy, restorative sleep promotes cellular repair. Yeah.
Okay, thank you, Dr. Goh. So in the interest of time, maybe we can ask one more question, because after this we will need to start to conclude.
Whose hand has been raised for quite a while.
Oh, okay. Thank you for alerting me to that. I see Joanne Goh. You have your hand raised as well. You can unmute yourself. Okay, Joanne, maybe while you, if you are going to unmute yourself, maybe you can wait a while. Then there's another person called Chia Hui Xiang. Are you interested to speak to Dr. Goh or Dr. Su? Okay.
Perhaps there's Michael Chong. Mr. Chong, do you want to unmute yourself? Or maybe the accident.
Oh, okay. Mr. Chong, are you there? Oh, he lowered his hand. Okay.
Yep. Okay.
Okay. How about Joanne or Chia Hui Xiang? Are either of you able to unmute? Okay. Maybe meanwhile I can follow up with one question about magnesium. There was a question about magnesium, whether it helps in sleep. Would either Dr. Goh or Dr. Su have comments on that?
Not that I am aware of.
Yeah, not that I'm aware of also. Yeah.
Okay.
Not standard information.
I see. Okay. Wendy, did you raise your hand? You can speak.
Hi.
Hi,
Can you hear me?
Wendy.
Yeah. Yeah, good evening. Yeah, I wish to ask about Dr. Goh. Usually I sleep, but half through the night, sometimes I wake up. Then I find that very difficult to go back to sleep. Is there any way to help?
Okay, so if you were here in earlier on, joined this session in time, yes, this is one of the very common problems in elderly. That there is a tendency to have interrupted sleep because of frequent awakenings, and once awakened, it's hard to fall back to sleep. So the practicing sleep hygiene would certainly help to a certain extent. However, I don't mean to say that if you do everything correct, this will not happen. So it is really about when you happen to wake up in the middle of the night, you go back to lie down quietly, and make sure that the environment is comfortable. There's no undue noise or lights that could actually be the cause of you waking up, or that maybe the fan is spinning too fast and you are actually feeling cold, or it's not enough and you're feeling hot. So all these kind of external factors that you can control. And if having corrected all these things and having emptied your bladder, and you are unable to calm down and relax, then you might actually get anxious about not falling back to sleep, and that itself can be a counterproductive. You actually end up getting more and more alert. So worst come to worst is, if you're not able to calm yourself down enough, you can try soft music, white noise, as I've mentioned. And otherwise, if let's say this happens many nights in a row, then you might have to really take a short-term solution of medication to just break the cycle of keep on waking up.
Okay, thanks. Yeah, and then may I know whether is it due to, because I just had a COVID about 2 weeks ago, so till now, on and off, I feel tired and sleepy, but although this case, but I can't sleep well also. So do you think I need to seek any medical professional advice?
Dr. Su, you want to answer that?
I think for some people after COVID, you do feel a bit more tired, more fatigue. But of course, you can monitor for a period of time and see whether it goes away before seeking a medical attention. I think you can monitor for another 2 to 4 weeks. Yeah.
Okay, thank you very much.
I do agree with that view also.
Okay. Thank you, Wendy, and thank you, Dr. Goh and Dr. Su. So I think that rounds up our last question for tonight in the interest of time, because we did overrun a little bit. So I think before I do the closing, Dr. Goh and Dr. Su, are there any concluding remarks that you'd like to just share about? Yeah, maybe Dr. Su, do you have anything to say?
I hope this be helpful for you all, right? Most of the time, the sleep conditions that we see are due to poor sleep hygiene, rather than some actual issues. But of course, it's good to be aware, all right? And hopefully this talk will be helpful for you to take note of some of the common poor sleep hygiene. Yeah.
Okay. Thank you, Dr. Su. How about Dr. Goh? Any closing remarks?
Yes. Well, just thank you for the opportunity to share. And as Dr. Su has said, while we give you a lot of information, be it medical or psychiatric conditions, these are not the common stuff. The common stuff is really that about lifestyle, about habits, about what you do throughout the day or not do throughout the day. So really, and I think the other thing is also to accept that okay, maybe I'm waking up 2 times in the night and I can't go back to sleep after like half an hour or 1 hour. But at the end of the day, if you wake up and you are not having a headache, you're not grumpy, you're going about with your marketing, with your mahjong, with fetching your grandchildren or whatever, scolding them, that's fine. You might be waking up 2 times in the night. You might have total, you add if you're obsessive, like, when I wake up in the middle of the night and then I look at the clock, I will say, 15:13, I'll remember the number. It's kind of like a crazy idea, right? But at the end of the day, just know that when you wake up and you are able to go through the day without any sort of discomfort, then you are functioning well. And just accept that this is part of aging. And I have 7 hours of sleep and I'm going through my day well, I'm happy. And don't let it become a problem when it is not a problem.
Very well said. Thank you, Dr. Goh. Okay. Once again, thank you everyone for being such active participants in the Q&A session, and also for Dr. Su and Dr. Goh for patiently addressing as many questions as they can. Yeah, so maybe let me just put up my screen again, and then I'll just do a small little recap for those who have missed off the first part of our event. So it is about our 2 main services for Sage Counselling Centre. So first is counselling, which is free for Singaporean citizens and permanent residents. You can always call us to find out more. The number is on the screen. And we also have the Seniors Helpline, which is a free national helpline with a very easy to remember number. So it is 1-800-555-5555. That is 7 5s in total. So this is for anyone aged 50 and above who is seeking a listening ear. You can just call the hotline. And we also have a short little announcement on next month's talk. So we are honored to have an adjunct assistant professor from NUS to share about the myths of diabetes. So more details will be available soon. You can follow us on Facebook or join our mailing list to sign up. So I'll place the links in the chat box. Okay, so for more updates, you please follow us on our Facebook page or complete the feedback form after the webinar ends. And for any other questions, we are also just an email or a phone call away. So thank you once again for joining us and have a good night, everyone. See you at our next webinar. Bye-bye. Thank you, Dr. Su. Thank you, Dr. Go.
Thanks, everyone.
Thank you, Andy.